Great, thank you ever so much, and hopefully you can all hear me and see my screen. So I'm going to be talking today about what impact COVID-19 has had on health and care in England, and lots of the issues that have already been described are absolutely true in England. So we saw a huge redeployment of the neurological workforce, as you know, neurologists, nurses, pharmacists, psychologists, etc. We're all redeployed to kind of the front line, so working in intensive care units and so on, to deal with COVID. Seen massive delays to initiation of treatment, particularly immunosuppressive treatments, because of the potential added risk of contracting a severe form of COVID. And of course, that could have a long-term impact on people's condition, for example, in MS, around progression of the condition. Rehabilitation across the board has been hugely impacted. So we've seen people discharged from inpatient rehabilitation before they ought to have been released, and then packages of rehabilitative support also hugely limited, to the point where people have been discharged to the community having had an acute neurological condition, for example, Guillain-Barré, with simply a list of exercises and not much else. We've also, unfortunately, heard of a lot of very difficult decisions that have had to be made around the provision of neurosurgery, you know, life-saving surgery or interventions like thrombectomy, which have had to be limited due to issues around the workforce or the need to free up beds for COVID. Similarly, we've heard of instances of gastric feeding and ventilation being disrupted. Ventilation in particular, because those forms of therapies have needed to be used to support people experiencing a severe form of the virus. As has been alluded to, access to procedures has been massively limited. So things like access to MRI, EEGs, that sort of thing, have pretty much halted or been severely limited. And as a result, we're seeing diagnosis slow down, and we've also seen a drop in the referral from GPs to specialist neurology services, also slowing down. And finally, if people are able to get a diagnosis, the way that's delivered is also changing. So because of some of the digital tools that have been adopted, to the point where we've heard of people being diagnosed over the phone, which I think makes for a really difficult situation for both the healthcare professional and the person receiving that news, you know, when you can't have that face-to-face and kind of personal contact with somebody. More broadly, in speaking to our members, a lot of the initial concern around the outbreak was around access to food. We saw huge shortages in supermarkets, people not able to get to their local supermarket, but depending on where they live, huge queues that they might be wary of because of, you know, the need to maintain social distancing measures. Online slots for supermarket delivery just impossible to access, to the point that apparently purchase of hens at home increased because people just wanted to get access to eggs, you know, and so it really was, people were very, very desperate, particularly at the outset of this outbreak. And similarly, there's been massive confusion here in England, certainly, about the advice that's being given from government. So who should be self-isolating, who isn't. The government wrote to lots of people in England to encourage them to stay home, to shield for 12 weeks, but there were massive issues in who got those letters and who didn't. And now we're entering the phase where it's really not clear who ought to be kind of emerging from shielding or the support that they're going to be getting throughout that process. And then speaking to our members about the kind of inquiries they're getting from people with neurological conditions, there's a shift from kind of what does COVID mean for me if I'm living with MND or if I'm living with a neurological condition, to the very, very real impacts on mental health, particularly for people that have been self-isolating for a really long time. And so the longer term impacts really need to be prepared for, and indeed we need to make sure that people are signposted to the right support and that we've got new ways of providing that support. We've also done some work about kind of how the voluntary sector has responded to this. And we did a short survey across the voluntary sector, predominantly neurological organisations, but it included some other charities too. And it's 40 organisations that responded. And as Mag's own survey alluded to, there's been a massive surge in demand for services since the outbreak began. So as you can see here, about 55% of people that responded to our survey said that they've seen a huge significant increase in need for their services. And the type of stuff that people are accessing, I feel, are like things like helplines. So it's common to see up to a 10-fold increase in calls to helplines. Seen a huge surge in demand online. So, you know, you can see there a quote from one of our members saying they've had more than 50,000 visits to their COVID-19 pages on their website just within a month. Some organisations have had to release emergency funds to help people during this really, you know, unprecedented times. And just overall, it's a picture of really increased need amongst the community, and particularly amongst the most vulnerable. But at the same time, the voluntary sector really are experiencing huge impacts on their own income and their ability to meet that surge in demand. So we also asked people what reduction in fundraising income they're expecting over the next 12 months. And as you can see here, more than 30% of people are expecting a drop of at least 25% to their income. And a further 27% expecting at least a drop of 40%. So you think about the impact of those organisations to meet that need, or indeed sustain themselves into the future. It's massively looking quite precarious, to say the least, at the moment. So what now? And I think we've already touched on this quite a bit, but there's huge digital transformation in how care is being delivered, increased use of telephone consultations and so on. And some of that really ought to stick around, because actually it might be a more efficient way of delivering services and saving people a 3-hour trip to collect their blood test results. And so thinking about what EFNA and what we could do is perhaps shine a light on some of those examples where you know, it seems to be improving patient experience and make for a more efficient model of care. At the same time, we're seeing the risk of digital exclusion increasing. We've already talked about the various communities that might, for which video consultation, for example, might not be suitable. But actually, you know, some of these digital tools are going to stick around. So I think it's about ensuring that they're available to as big a cohort and as diverse a cohort of people as possible. And there's opportunities there, I think, for us to work together, perhaps with private partners, to think about how we can minimise digital inequalities, and for example, through emergency grant funding for appropriate tech, that sort of thing. Obviously, the voluntary sector are critical to kind of building back better from all of this. And I think, you know, we've seen the economy is taking a huge hit. So we're expecting recession across Europe if it hasn't already arrived. And I think Brian talked earlier about the need for a strong economy in order to ensure the health of the nation. And the opposite is also true. So really, we need to come together to make sure that when key EU players, national governments, etc., are thinking about how they're going to mitigate the economic crisis, that any difficult decisions around cuts to spending, for example, are made, the most vulnerable, and indeed people with neurological conditions aren't disproportionately impacted by those decisions. And indeed, that support for our health, our care, and you know, welfare systems is absolutely maintained, because they're critical to all of this. I've talked as well about kind of mental health in particular. I think there's an opportunity for us to work together to think about bespoke support to maintain and manage mental health needs as a result of this pandemic. We've talked also about, you know, the impact on informal carers who, you know, really are picking up the burden when NHS or health and care services just aren't there at the moment due to the need to deal with COVID. So is there an opportunity there for us to work with carers organisations to highlight the very real impact on friends and families of people with neurological conditions, and call for more support to be in place? And again, as has already been alluded to, this really is a marathon, not a sprint. The recovery is going to take time, both of our health and care system, as well as our economy more broadly. And so there's a real need to work together to understand what interventions are going to have a longer term impact and a positive impact for people with neurological conditions. And it's going to be absolutely critical to ensure that we understand and build on patient experience in that respect. But crucially, that people with neurological conditions aren't left behind as we seek to recover from all of this. Thank you.
It's interesting listening to Georgina there, and someone else mentioned this about it being a marathon, not a sprint. I don't know how everyone else feels, but right now it does feel like we are sprinting in a marathon because of the sheer amount of change and work that we're all doing right now to respond to this. So yes, trying to keep fit in this COVID episode is quite interesting. So we've been asked by EFNA today, thank you Donna for inviting me to give you the perspective of the Stroke Alliance for Europe. My name is Arlene, Wilkie. We were asked to consider 3 things from EFNA. We were asked to consider the challenges, the opportunities, and call to action for EFNA. So I do have 3 slides. A lot of it, I'll try not to repeat too much as to what's been said already. Interesting from a stroke point of view. It's very, very similar to what our previous speakers, when we talk specifically, when people have talked about neurological conditions. So in terms of the challenges, these were the 4 things that I have thought about, and I've split it into what our patients and our patients are telling us, what our members are stroke support organisations, and that's the abbreviation SSO. So what are our member organisations saying in terms of response, and a bit about research in terms of challenge. So I'm talking to you a mix of surveys that we've done, but also evidence that we've read and the surveys that you guys have recently put together as well. So the fear, and we've already heard this word mentioned a couple of times, the COVID-19 has given us a new challenge to the public, and that is fear of going out, fear of catching COVID, fear of going to hospital and not being a priority health condition. And of course, dying alone. That's incredible fear for people going in and with a serious health condition and dying alone in isolation. And we know this is a problem for stroke in that the number of people attending emergency care has dropped. And in addition to this, there's also the new fear that Eleanor talked about earlier on, about people coming in with a COVID condition and then suffering from subsequent stroke. So this is also a fear of this new neuro aspect that's linked to COVID as well. So that's my fear challenge. The next challenge is access to care. Again, people have already talked about the access to care being a challenge. We know that workforce is being deployed. We know that because of the whole trying to reformulate services. We also know that healthcare individuals they're taking ill themselves, so that there's a lack of them. We know that people from stroke patients are being discharged, and there's little rehabilitation happening in hospital. There's little rehabilitation happening outside hospital in the community. So less home visits, less rehab, all of this. So people not going into hospital, suffering stroke in silence, people being in hospital, going home with less care, is going to lead to a potential long-term problem for stroke and other neurological conditions in terms of potential long-term disability, because they've not had the care at the right time that they needed. In addition, of course, we've got people not taking enough exercise, social isolation, vulnerability, financial aspects. It's all leading to an increase in anxiety and depression that our stroke survivors are facing, which will be the same for the neurological community as well. So how are our stroke support organisations responding? In the same way that you guys on this call are. We are developing, so this is from our survey, our stroke support organisations are rapidly developing new resources, rapidly developing new resources. They're sprinting in this marathon at the moment. And they're developing things like at home, things that the people can do at home. So they're producing exercise videos, leaflets that they can send out, and they're delivering this information online, whether it's Zoom, whether it's Facebook, any kind of digital means that they can reach people. In addition, we know that people are also doing an awful lot more in terms of telecare, via the telephone. So we know that in some countries, some organisations are actually working with their governments so that each individual patient that is diagnosed gets a phone call from that charity and then provides them with the information they need. That's an extreme case. In other cases, it's about the medics knowing that the stroke support organisations exist and about the information, and so they can provide that condition-specific information to the patient. So it kind of, as Mags was saying, it's how do the patients get the condition-specific information? So our SSOs are reaching out to governments to say, we are here and our information is online. Please, clinicians, use this information. So all of this is a great response, but again, as has already been mentioned, not everybody is online, not everybody can use digital means of communication. And for stroke patients and other neurological conditions, they may have communication difficulties in terms of, so the brain injury that people can suffer will mean that sometimes the printed word is often not doesn't meet their needs, and the visual communication might not work for them either. And of course, we've got the problems of different types of stroke support organisations in Europe. Europe is a very big place. I'm generalising, but I would say in the West, charities maybe have a lot more presence than they do in the east of Europe. So we've got a bit of a disconnect here as to what stroke support organisations can do to support individuals. The sustainability, so Georgina has already mentioned this in terms of the Neurological Alliance for these in Europe. Our survey showed that over 75% of our SSOs are concerned about their future. They are currently having to lay off staff, they're having to cancel events, so the funds are dropping, the funds are changing. So this again adds another problem back to our patients. If we don't have stroke support organisations in Europe filling the gaps that our medics and our medical world can't fill, then again our patients are going to suffer because of that gap that the SSOs aren't able to fill, because they might not be around in the future. An additional challenge is about research. We've already talked about this, so in brief, lab-based, desk-based research is very difficult to do just now because of lockdown and people being laid off. Clinical research can't be done, face-to-face stuff can't be done. And charities, certainly in the UK, we know that many of the charities in the UK are withholding funding any new research in the next year. So again, the long-term impact for patients is that there's going to be delays to new findings for stroke. So moving on to the opportunities, again, just kind of thinking this through. So the opportunities that our SSOs have seen, they are working nationally. They will be working with medics to explain to them, here is our stroke information, please disseminate it, please refer people to us. We want them to be working with our governments to increase the profile of stroke. As was noted earlier on with the WHO resolution, stroke must still be a health priority in your country. So that's kind of an SSO response. I've already talked about the digital ways of working as well. For SAFE, so for my organisation's response, it's been a rapid 6 weeks worth of learning. We are quickly becoming a hub of information. So I've already been in touch with my comms lead about the European Academy Neurology Stroke Group and about the stroke advice that they're putting out. So we've already got that up online and since this conversation has been going on. So we see something, we have to communicate it very quickly. We're also having our own virtual meeting with our members in a few weeks' time, which we've not held a meeting like this before, so we're responding in a nervous way as well about bringing people together and holding these kind of meetings. And it's also revitalised our thinking around policy work, and I'll come to some of that in my final slide. I think that policy work that SAFE needs to do at that European level, I think we always had the plan to do stuff. Again, like EFNA had their strategic views last year. What this is going to do is it's going to accelerate things. This will accelerate our response to solving some problems that we wanted to do, but we maybe had put stuff a little bit in the back burner, but it's rapidly going to change our views as to how we respond. Other opportunities are to work in a coordinated way, so to reach out, for example, to talk to EFNA and talk to other organisations in Europe to talk about how we come together. Obviously, stroke has its own priorities, but we want to make sure we're working in collaboration with the right people to make sure that stroke voice is heard within a coordinated response. And finally, I think all of us, we need to apply what we've learned. And if we can work out a way of sharing what we're learning and what's good and what's bad, I think that can only help the whole community. So then just finally, Donna and EFNA asked for some recommendations for action for EFNA itself. So hindsight is a great thing. We would have done exactly the same. We would have had a quicker coordinated response. And this is something we have learned now that should this, when this, if this happens again, we will look to bring our community together much closer, much quicker to find out who's doing what, how we can support and how we can share. And I would look to EFNA to do a similar thing in the future. I would also, and I am at the moment looking to EFNA for guidance on two levels for me. One is around, I think bringing us together like this is really helpful. I love newsletters, but I also do like this kind of face-to-face and talking with each other. I am looking to EFNA, and Donna knows this, I'm looking to run a General Assembly at the end of June. There's a whole new bunch of legislation that's come out from Brussels, and I am looking to people to help and guide me in the absence of having a lawyer on board, because we're a very small organisation with no lawyer on our payroll, let's say, that we want to pay for this. So looking to other organisations to help us understand how are we all adapting and running our organisations. So not the patient side of it, but our organisations. What support can we give each other? What's the best platform for virtual meetings? What's happening with the governance side of things? And I've been looking to Donna to support, to help with this. So this would be something that would be amazing if EFNA could look into. But also, I think back to EFNA's role around policy, it's about, again, these face-to-face meetings. If we had a policy kind of catch up around what's going on at the EU level, who are the organisations that we should know about, who should we be working with, who should we be contacting, where do we put ourselves in terms of raising that profile, I think would be absolutely invaluable for an organisation like myself who doesn't have a policy lead, for example. So again, I'd look to EFNA to do that. Learnings, again, look to EFNA, how do we capture all of this? How do we capture all the learnings to make sure that we can have that quicker coordinated response in the future? And then finally, to EFNA, campaigning ideas. So I'm sure I saw in EFNA's recent newsletter about a parliamentary question you put forward about non-communicable diseases, and it was already spoken about WHO and non-communicable diseases. I think it's absolutely essential that in this world right now, infectious diseases is a priority, absolutely. However, other conditions still exist, they still happen, they are not going away, and we must make sure there's still equal investment into those sectors. So I'd look to EFNA to make sure that we are part of that. And finally, and I think this is a bit more of a tricky one for me, I'm new in the European world. I would love to see EFNA and others talk, and I don't know how to articulate this, so I'll try and do my best. We have invaluable stroke support organisations throughout Europe. and other kinds of non-profitable organisations throughout Europe. We must make sure that somehow our governments see these sectors as valuable as the medical sector. And I would like to understand from EFNA, and maybe it's another organisation that's working on this, how can we also champion the valuable, invaluable work that our non-profit sectors do in Europe and make sure that's not forgotten in this whole COVID situation as well. And that's me, Donna. I am finished. Thank you for your time.
Thank you very much, Arlene. And actually, I think a lot of what you have said will come up again in some of the follow-up presentations. I'm jumping really quickly to Astri because Astri, I realize you have another call in a couple of minutes. So I will let you give your presentation and run away before we come back to some of this discussion. So off you go, Astri.
Thank you very much. Can you see me now? My
yes, we can.
Camera is on.
Yeah.
Okay, I don't think I need to show my presentation. It's just some points for me to remember what to say. So thank you so much for inviting me, and thank you everybody for holding in there, because I know this is a bit intensive to follow so many talks in a row. So I'm president of the European Huntington Association, and I will give our perspective from the Huntington disease group in Europe. And I think that we just need to realize that the situation is not homogeneous. Europe is a big continent in terms of differences and how both the pandemic has affected regions and countries and how it has been managed. So it's really a heterogeneous situation, I would say. But of course, in general, what's happened is that patients have been that their access to health and social services has been erupted to a large extent, I would say. We have not done our own surveys to measure this, but this is really what I hear from our member organizations throughout Europe. And this cause, of course, trouble. But I would like to just also underline some other consequences, because for when you have Huntington's disease, you have really challenges related to your cognitive abilities and also your emotional and psychological well-being. And I think that the total change in daily routine that this quarantine or this really isolation policy put in place to all of us has really caused a lot of strain on our families and patients. And I think that that this needs, in the aftermath, we need to really have this documented, and also in case of how we can prepare for the next round and how to deal with crises like this. I think it's the isolation, the consequences of isolation for these patients and families is enormous, and it puts a huge pressure on families. And I think I saw some of that from the survey from Ireland, where family members in relation to patients themselves report even bigger challenges and on this situation than the patient themselves. So I think I'm quite sure that there are so many Huntington families out there who have been isolating for so many weeks, who are really being more or less torn apart. That's also what we hear from our several of our member associations. To be torn out of your daily routine, to not be able to walk outside and allow some distance when you have somebody with such a severe disease is causing enormous pressure on families and patients and are all in the family. So I would say there are also upsides in this. Even if people have not been able to go to their clinic or to have follow-up on their daily or weekly services with the physiotherapy or whatever it is, there has been many clinicians really doing their best in reaching out to these patients via e-solutions, electronic solutions like we're having today. And also I would stress that because I realize not everybody is online and using internet the way most of us do here, but also phone. That's what I hear. If you're not able to reach them via Zoom or other e-platforms, most people have a smartphone, or a much larger number of patients have a smartphone, and they are able to use for instance, WhatsApp. And I think that there is also some opportunities here to really have these solutions more implemented into daily care, because obviously it will provide easier access for a large number of patients, and even if I realize not all. And I think also that this unprecedented situation has increased definitely the competence in the general public to use these platforms, because when you are not able to go face to face to see your doctor or whoever you are needing to see, when you have to, you tend to be able to learn the needed skills to make use of Zoom, for instance. So I think we will see, somebody mentioned there has been an explosion in the use of electronic solutions, and I think that's also the case in the patient and the family community. But I think in the aftermath of this, we really also should use the opportunity to have a renewed discussion about healthcare priorities. Because in how I have seen this situation is that we have had some kind of a panic driven reaction to this pandemic, in terms of having everybody needing to isolate, and curfew has been inflicted on a lot of people in many countries for a long time. And I realize that's done to really keep us safe from the virus. But on the other hand, I think we need, for the next time this may happen again, we need to have plans put in place where we can differentiate and not expect Huntington patients and Huntington families necessarily to put on the same very strong constraints in isolation, because it costs them so much harm on their health. So we did this, for instance, in Norway, where I'm based. When we closed down schools and kindergartens, we kept some places open for those in special need. And I think this needs really to be put into plans for the future, or how can we take care of these very vulnerable groups next time we need to keep the population in general more separated from each other, in isolation, because I think really they should be considered to have special needs here and be allowed to services and to move in ways to enable to take better care of their health and well-being through such a crisis. So I would say my recommendations maybe is that we need to underline and document this inequality of consequences. I myself have been living very isolated for 2 months, and I'm fine. It's not a problem for me. Others have really suffered. So I think this needs to be documented, how really this affects families. And then we need to advocate. I think that's a good idea, actually, to advocate to have these kind of contingency plans for future health crises. How can we react to a crisis like this, and at the same time be prepared to take care of the really vulnerable people in terms of their health and also social well-being. And of course, as everybody else have seen here, said here, we need a strong advocacy for continued and enforced focus on not infectious related diseases. And I fully support the statement from the European Brain Council that the brain health is a constant crisis, actually, and needs to be continued. So I think that was my main point for this discussion related to the situation we're in. So thank you for your attention.
Perfect. Cool. Thank you very much, everyone, for staying so long and also bear with us for the end of this meeting. I will try to shorten my presentation as much as I can, because I have to say, many of the items I wanted to talk about have been addressed now with the stakeholders, and I think their messages have been really clear and repeated across the throughout all the speakers' interventions. So here I am Elisabeth Kasilingam, EMS PCO. So I work for the European MS platform, and we have done an impact assessment of the COVID outbreak with our community to see how it has affected the organizations and the people with MS across Europe. But as I was saying, many of the challenges that the people with MS are facing are quite similar to what we've heard before. So I will try to be short on the presentation of the outcome and maybe raise more questions to EFNA. So I will skip some of the slides that I was preparing. The reality pre-COVID was already a challenge for the people with MS and for the patients with neurological disease, as we all know. So we know there were identified issues, and Donna already said in the strategic goals, they've set those 3 focus areas. Those are still there, and probably that after this outbreak and going back to the normal life, as we say, it's going to be worse for the people who are living with those conditions. So our focus now really should be on understanding what are those needs and trying to address those even better and in a more efficient way than what we have been doing so far. Throughout our membership survey that we've run, the issues that have been highlighted, as I was saying, are quite similar to those that were mentioned before: financial difficulties, the support for the individual, the psychological support, the lack of information provision, the not knowing where the reliable data are, information for specific conditions were not available, and all those required some immediate actions. So what we investigate a bit, what could be the solutions to address those immediate needs. And those are again quite similar to everything that we've heard before from the previous speakers. So I'm not going to go more into details, but I can share, of course, the more detailed results of our survey later on if anyone is interested. In terms of resources, what is needed, we also investigated more to know what could be done to support the community, to support the organizations, and to support the individuals. And there are 3 aspects that are key. I think that we need to really focus on as advocacy organizations and working together with EFNA. The individual needs, the organizational needs, and the healthcare systems. So in terms of the individual needs, there are still a lot of learning that is coming up, a lot of data that needs to be collected to better understand what's going on. One key question I think that maybe EFNA could help us to reflect on is about the definition of the vulnerable population. So the issue is really how do you promote, or do you put forward the people with neurological conditions, and how to make sure that the voice of the community is heard. And there is a need for a mainstream approach. There is a need for further collaboration on this across Europe, so that we can really help the governments now. This is the time now, I guess, to get back to them, to talk with them and see if they are considering the patients with neurological conditions as part of the vulnerable population. So this is something, a definition that is not clear, that is been mentioned so many times now, but are we part of this vulnerable population? And if yes, what are the criteria? How can we bring that forward on the agenda of our healthcare, of our decision makers? So this needs to be worked out. what would be the protective measures for the people with MS, but also with neurological conditions? So what is needed? There are a lot of work that is being done by the communities themselves, but again, if with the work with FNOT support, if we can come back to a consolidated approach, it will help the decision makers, and it will help the advocacy groups to talk with the authorities. This comes from the Czech experience, where the Czech governments really looked at the patients groups and asked them to come to with a collaborative approach, so that it will make their understanding better, and also the way they will tackle and address the needs that have been expressed by the patient community more efficient. And this has to be done at European level too. So if this is the time now more than ever to work collaboratively, and I think FNOT should lead this this approach and help us to define the way we can dialogue with our decision makers, and specifically at national level, so that the patients can get to concrete solutions more faster. The shortage of treatments in the case of MS, it was mentioned that at the moment the people with MS still have a good access to their treatments. So this hasn't been affecting too much the patient's community, but we know that on a long term there will be some issues coming up. And again, this is the time now to engage in a dialogue with our policy decision makers, to make sure that whenever they will take decision on budgeting for next year and beyond, they are taking into account this issue. So shortage of treatment should be on the agenda of the national and European policy decision makers. And again, that is something that maybe EFNA could take up on in the work further that they will do with their member organization. So there are the mention of the access of care for the non-COVID patients and the mental health. So again, that is something in terms of access to care that needs to be investigated and see how this can be done. Investing in digitalization could be one of the solutions, obviously. So now the more and more, it's a learning phase where different healthcare professionals are also testing those new ways of providing care, and this is an opportunity that we shouldn't miss. And being able to identify best practices, being able to showcase that the benefits of this type of cares towards the decision makers would be a valuable input for long-term strategy in terms of digitalization, in helping the member states to change and invest in this way of providing care, but the review the reimbursement systems and so on. There is a lot of work to be done at policy level on this. So again, another way for EFNA would be really to gather all those evidence throughout the neurological disease community, and be able to showcase that within initiatives or within any events that are coming up with the European institution, that would bring added value to move our work forward. In terms of the organizational needs that were highlighted, mainly the sustainability of the patient's organization. Again, that's something that has been mentioned several times, but one of the key opportunities here is really to engage with our policy decision makers, to be really active in public consultation and help the policy decision maker to set their priorities around this. Not only at European level with the next granting period and so on, but also at national level. The role of the patient organization have been crucial during this pandemic. So they have been providing the support that the healthcare and social care system couldn't provide, but they are facing sustainability issues. So to be able to maintain the activities and to be relevant, that we should use this opportunity to really show that to our decision makers. So again, something that maybe EFNA could consider helping us on building our strategies. In terms of the healthcare system, so as I was saying, it is important that we look beyond the pandemic and that we think about, and that was mentioned in the first two presentations, into how we can help improving the healthcare systems, help our decision makers to understand better what were the flaws during this pandemic, and make sure that the future healthcare system are equipped and are useful. Another key point, I think, is the data collection. This is something that has been crucial during this pandemic period. So the lack of data to take appropriate measure and to be able to react faster is just not there. We are not equipped for that yet, and so supporting the initiatives on the data collection would be really important at this stage. So that we keep pushing for that, and that it will help to improve the quality of the care and that provided to the patients. So my concluding remarks will be really those points. So it's time for solidarity within this EFNA membership to see how we can collaborate further, to define together the definition of the vulnerable population, that it doesn't become a competition between the patients community, that we reinforce the alliances and that we could speak in one voice. So my call to EFNA is really to define a common strategy and to support a European campaign, and also to think about this shift of the role of the patient organizations that have been really key in compensating some of the lack within the health and social care system, and that needs to be recognized, and this could be a way also to promote the all patients movement towards our decision makers. So thank you very much for having us here and to providing the platform to share our thoughts, Donna. I think that was a great initiative. So I will give you back the floor.